Pathology, contraindications, areas of caution, special populations, MBLEX exam question and answer. Question 1. Which would you expect to see on a person with jaundice? A. Redness of the skin. B. Scaly, dry skin. C. A bluish skin tint. D. A yellowing of the skin. The right answer is a yellowing of the skin. Explanation: jaundice comes from the French word jaune, which means yellow. Increased levels of bilirubin in the blood is what causes the yellow discoloration of skin. Question 2. When would you use rice? A. Athlete's foot. B. Canker sores. C. Sprained ankle. D. Hemophilia. The right answer is sprained ankle. Explanation: rice stands for rest, ice, compression and elevation and is best applied to an acute injury such as a sprained ankle or when heat or inflammation is present. Question 3. What symptom would be expected in a client diagnosed with cataplexy? A. Abnormal heart sound. B. Temporary muscle weakness. C. Weakened section of blood vessel wall. D. Sleepwalking. The right answer is temporary muscle weakness. Explanation: cataplexy is considered a rare disease but common among those who are prone to narcolepsy. The condition is typically triggered during experiences of intense emotions that causes a sudden, temporary loss of muscle function while the person is fully conscious. Question 4. Which organ does cystic fibrosis occur in? A. Heart. B. Lungs. C. Kidney. D. Liver. The right answer is lungs. Explanation: cystic fibrosis is a condition which causes scarring cysts in the pancreas, liver, intestines and most notably, the lungs. The cysts secrete a thick mucus which lines the alveolar sacs in the lungs, rendering them inefficient and prone to infection. Question 5. People who regularly do repetitive motions of the hands and wrist have a higher risk of developing A. Crohn's disease. B. Loss of muscular function. C. Carpal tunnel syndrome. D. Cubital tunnel syndrome. The right answer is carpal tunnel syndrome. Explanation: carpal tunnel syndrome can affect anyone. But people who regularly do repetitive motions of the hands and wrist, and people who are obese, or are affected by diabetes or rheumatoid arthritis have a higher risk of developing carpal tunnel syndrome. Question 6. Which cranial nerve is directly affected in Bell and number 8217 palsy? A. 5th. B. 6th. C. 7th. D. 8th. The right answer is 7th. Explanation: Bell and number 8217 palsy is a dysfunction of the 7th cranial nerve when no specific cause can be identified. The resulting symptoms are a partial paralysis of the face and is the most common acute mononeuropathy or disease affecting one nerve specifically. Characteristics of Bell and number 8217 palsy are facial drooping and immobility of muscles attached to the affected nerve. Question 7. What is a scientific benefit of aromatherapy in relation to allopathic medicine? A. Antimicrobial. B. Energizing. C. Pain relief. D. Relaxation. The right answer is antimicrobial. Explanation: aromatherapy uses plant-based essential oils for the treatment of various conditions. Many of the oils possess antimicrobial properties and have been incorporated into Western medical treatments to fight against infections and disease. Question 8. Which of following is a concern for massaging a client with a diagnosis of enuresis? A. Sneezing. B. Incontinence. C. Headaches. D. Blood clots. The right answer is incontinence. Explanation: enuresis is the inability to control bladder function, most often in people in later stages of life. Question 9. Which of the following techniques is contraindicated if a client is taking blood thinners or anti-inflammatory medication? A. Cross-fiber friction. B. Effleurage. C. Trigger point therapy. D. Shaking, jostling. The right answer is cross-fiber friction. Explanation: cross-fiber friction is designed to create micro-tears in muscle and tissue, triggering an inflammatory response for healing. If a client is on blood thinners, excess blood in the immediate region could cause unhealthy bruising. If a client is on an anti-inflammatory medication, the purpose of the technique is negated. Question 10. Which nerve plexus is involved in thoracic outlet syndrome? A. Lumbar. B. Sacral. C. Brachial. D. Cervical. The right answer is brachial. Explanation: thoracic outlet syndrome is a compression condition that affects the brachial plexus as well as the subclavian artery and vein. The brachial plexus nerve root originates at C5, C8, T1 and extends into the terminal branches of the axillary, median, musculocutaneous, radial and ulnar nerves. Question 11. How can a bladder infection go into the kidneys? A. Through the glomerulus. B. Through the ureters. C. Through the urethra. D. Through the glomerulus. The right answer is through the ureters. Explanation: bladder infections are caused by germs or bacteria that enter through the urethra and travel into the bladder. Normally, the body is able to remove the bacteria by clearing it out during urination. Sometimes, however, the bacteria attach to the walls of the bladder and multiply quickly, overwhelming the body's ability to destroy them, resulting in a bladder infection. Question 12. What is the term used for increased blood flow in tissue? A. Hyperemia. B. Hypoxemia. C. Hyperthermia. D. Hyperthyroid. The right answer is hyperemia. Explanation: hyperemia or hyperemia is the increase of blood flow to different tissues in the body. It can have medical implications, but is also a regulatory response, allowing change in blood supply to different tissues through vasodilation. Clinically, hyperemia in tissues manifest as erythema, because of the engorgement of vessels with oxygenated blood. Hyperemia can also occur due to a fall in atmospheric pressure outside the body. Question 13. Which of the following is an inflammatory joint condition caused by deposits of uric acid crystals? A. Rheumatoid arthritis. B. Gout. C. Bursitis. D. Tenosynovitis. The right answer is gout. Explanation: gout, a complex form of arthritis, can affect anyone. Men are more likely to get gout, but women become increasingly susceptible to gout after menopause. Question 14. A person who is complaining of feeling cranky and nervous, having frequent headaches, sleeping trouble, shaking or trembling, tingly or numbness in skin and unclear thinking could be suffering from which of the following conditions? A. Hyperglycemic. B. Depression. C. Hypoglycemic. D. ADHD. The right answer is hypoglycemic. Explanation: all of the symptoms above are issues relating to hypoglycemia or decreased levels of blood sugar. Hypoglycemia occurs when your body and number 8217s sugar, glucose, is used up too quickly, when too little glucose is released into the blood system, or when too much insulin is released due to excessive sugar intake via food or drink. Question 15. Which of the following systems is directly affected by multiple sclerosis? A. Circulatory. B. Muscular. C. Nervous. D. Digestive. The right answer is nervous. Explanation: multiple sclerosis is an inflammatory disease that attacks the myelin sheaths of the brain and spinal cord. The resulting condition affects the nervous system's ability to communicate and progresses to inhibit both physical and cognitive function. Question 16. Which of the following conditions is an autoimmune disease that is typically hereditary and not contagious? A. Herpes. B. Shingles. C. Melanoma. D. Psoriasis. The right answer is psoriasis. Explanation: psoriasis is a non-contagious autoimmune disease where the body mistakes the skin as a pathogen and sends faulty messages to speed up the growth of skin cells. There are 5 types, but the most common is plaque psoriasis, which exhibits scaly, red and white patches of skin. Massage is contraindicated directly over the affected area but indicated over unaffected skin. Question 17. What is still in number 8217 disease related to? A. Viral infection. B. Arthritis. C. Bacterial infection. D. Hypertension. The right answer is arthritis. Explanation: still in number 8217 disease is juvenile rheumatoid arthritis that affects children under the age of 16. Arthritis cannot be cured, but the symptoms can be relieved via massage therapy. Treatment, however, is best when in conjunction with other healthcare professionals. Question 18. What type of massage is indicated for someone with hemophilia? A. Light effleurage. B. Deep tissue. C. Tapotement. D. Trigger point. The right answer is light effleurage. Explanation: hemophilia is a condition that affects a person and number 8217's ability to control blood clotting. Deep pressure massage on a client affected with hemophilia can cause deep muscle bleeding that can lead to swelling, numbness and/or pain. Question 19. An excess of potassium in the blood, hyperkalemia, is a result of which improperly functioning organ? A. Kidney. B. Lung. C. Heart. D. Stomach. The right answer is kidney. Explanation: hyperkalemia or excessive potassium in the blood is an indication of a poorly functioning kidney, which is responsible for regulating blood serum. Question 20. Rheumatoid arthritis, lupus, chronic fatigue syndrome and Sjogren and number 8217 syndrome are all examples of diseases. A. Autoimmune. B. Deficiency. C. Pathogenic. D. Infectious. The right answer is autoimmune. Explanation: all the examples listed in the question are autoimmune diseases and all have their own contraindications and indications for massage. Question 21. What part of the body is affected by peritonitis? A. Brain cavity. B. Abdomen. C. Thoracic cavity. D. Lungs. The right answer is abdomen. Explanation: the peritoneum is the membrane that lines the abdominal cavity. Therefore, peritonitis is an inflammation of the peritoneum. This condition can be caused by bacteria or a chemical irritation. Pain and tenderness in the abdominal region are common symptoms. Question 22. What is occurring when vasodilation increases the permeability of small vessels and fluid leaks into surrounding tissue? A. Anixia. B. Chemotaxis. C. Edema. D. Hyperplasia. The right answer is edema. Explanation: edema is an abnormal accumulation of fluid that causes swelling. The locations can vary from beneath the skin or in one or more cavities of the body. There are many causes and types of edema, but a common form is cutaneous edema, which is also known as spitting edema, a condition which occurs when pressure is applied to a small area of skin and an indentation persists for some time after the release of pressure. Deep pressure massage is contraindicated with edema. Question 23. What area of the body would you find diverticulitis? A. Lungs. B. Skin. C. Stomach. D. Large intestine. The right answer is large intestine. Explanation: the first symptom of diverticulitis is pain in the abdomen and more specifically, the lower left quadrant in the large intestine. Fever, diarrhea, nausea and constipation are additional symptoms. Massage over the abdomen is contraindicated. Question 24. Where would a Baker and number 8217 cyst be located? A. Wrist. B. Knee. C. Elbow. D. Feet. The right answer is knee. Explanation: a Baker and number 8217 cyst is a benign swelling of the semimembranous tissue or synovial bursa behind the knee. This condition is also known as a popliteal cyst but is often referred to by the name of the surgeon William Baker who first described the condition. Question 25. What would you call a sudden and painful involuntary muscle contraction in a client? A. Convulsion. B. Spasm. C. Hypotonicity. D. Contracture. The right answer is spasm. Explanation: a sudden and painful involuntary muscle contraction is a spasm or muscle cramp. A contracture is a permanent shortening of muscle due to prolonged hypertonic spasticity. Question 26. Pins and needles, numbness or burning sensations are an indication of which system malfunction? A. Muscular. B. Endocrine. C. Nervous. D. Skeletal. The right answer is nervous. Explanation: pins and needles, numbness or burning sensations are caused by nerve paresthesia, which literally translates into abnormal sensation, and can occur either chronically or acutely. Question 27. What part of the body is directly affected when a client has conjunctivitis? A. Eyes. B. Ears. C. Heart. D. Liver. The right answer is eyes. Explanation: conjunctivitis is the technical term for pink eye, a condition caused by either viral or bacterial infection of the conjunctiva or mucosal lining of the external surface of the eye. This condition is contraindicated until symptoms have completely resolved. Question 28. A loss of muscle mass and strength due to immobility is referred to as A. Muscular dystrophy. B. Myositis. C. Atrophy. D. Myopathy. The right answer is atrophy. Explanation: all of the answer options relate to muscle issues, but atrophy is the only condition caused by immobility. Myositis, muscular dystrophy and myopathy are systemic or internal issues that directly affect the muscles. Atrophy of muscle is the wasting away or degeneration of muscular tissue which can be caused by systemic issues not directly pertaining to the musculature. For example, a bedridden person can develop atrophy of their musculature due to immobility. Question 29. Which of the following choices best describes scleroderma? A. Bacterial infection. B. Itchy, flaky rash. C. Thick skin and joint stiffness. D. Loose, flaccid skin. The right answer is thick skin and joint stiffness. Explanation: scleroderma is an autoimmune disease of the skin that can affect internal organs and joints as well. There are two types of scleroderma: limited systemic, which affects a local area, and diffuse systemic, which is throughout the body. Acute inflammatory stages of both types are contraindicated. Question 30. A client indicates they have a hematoma. What would a massage therapist expect to find? A. A malignant skin growth. B. A large mole. C. An area of bruising. D. A benign growth of vascular tissue. The right answer is an area of bruising. Explanation: a hematoma is an accumulation of blood outside of a blood vessel, and when this occurs in the skin it is known as a bruise. Any part of the body can accumulate blood and thus a hematoma can be found in muscles, the brain and other body parts.